In this section, I'm going to talk about vasodilators, just some general information, and about what happens in congested heart failure. So we've talked about in the previous section, we talked about vasoconstriction and how when we get that in response to low blood pressure from a failing heart, then that can activate the renin-angiotensin system. And so we're going to talk about how if we vasodilate, so we dilate the blood vessels, how that helps the congested heart failure patient. So I'm going to start first by telling you that in your book, there is a box on page, it's not the box that I've been talking about, it's a different box, okay? It's a box on page 135, and it's a you need to know box, and it's about what causes ascites and pulmonary edema. And it took me a while to adopt this textbook because of this box. This box talks about things that happen in the heart, and it confuses the left and the right-sided heart as far as describing what goes on in congestive heart failure with right and left-sided heart failure. So I'm going to start with talking about that. So let's say that we have a heart that is failing on the right side. So the right side of the heart is not able to pump as efficiently. What will happen is the blood will begin to back up because we're not pushing as much blood into where does it go from the right side when it's pumped out of the right side? Into the lungs, right? Into the lungs. And so it backs up from the ventricle into the atria on the right side of the heart, and then it goes into the vena cava. And so what we see clinically with that is we will see a jugular vein. Our jugular veins will pulsate if we don't have a real furry animal. If you had a really furry animal, you'd have to clip the fur, but you would see jugular pulses because it's backing up cranially. Now, caudally, it also backs up, and it goes to the first organ downstream, which is the liver. So the liver gets congested, it gets enlarged, hepatomegaly occurs. As it backs up further, the blood vessels begin to weep fluid. They leak or weep fluid. It does not stay in the blood vessels, and it accumulates in the abdomen. And that is referred to as ascites. That is, an animal will have a fluid wave if you push on their abdomen. And I once had a dog come in. It ended up having a heart-based tumor, chemodectoma, and that dog it had ascites, it had swelling going into the limbs, which is unusual in small animals, happens more in large animals with heart failure. But anyway, so that animal had considerable ascites and other types of edema. All right, now let's talk about the left side of the heart. So the left side of the heart, when it fails, let's assume that our right side is still okay, but our left side is not pumping efficiently, and we're not getting the blood out into the aorta. It's backing up into the left atria, and into the lungs. And so we get pulmonary edema is what it's called. We get a pattern, and in your case study, you'll see some of that, a pattern in the lungs that shows that there is fluid in there, and that will show up in the patient as coughing. Okay, so if you look at this box in your book, it's going to tell you the opposite of what I just said. So think about it. It's logical if you begin to think about where the blood will back up to depending on which side of the heart is failing. So if we can dilate our blood vessels, this can help our patient because it allows more room for that fluid. We're going to do some other things at the same time, and some fluid control that we'll talk about later on is through use of diuretics. So this is a multimodal approach when we have congestive heart failure. So the diuretics are gonna get rid of fluid from the body, and then we have more room in our blood vessels with vasodilators, and so that's going to ease the blood pressure, and it's going to make it easier for the animal's heart to pump blood around. That's the basic effect of vasodilators, is they make it easier for the heart to pump blood. All right, so we're going to talk about these classifications. So I'm going to start out by saying that vasodilator drugs tend to work on both the arteries and the veins, but they are classified according to which ones they work more on. So we have arterial vasodilators, amlodipine, and hydralazine. And then we have venodilators, and the only one we're going to talk about is nitroglycerin. And then we have ones that act both on the arteries and the veins, and pretty balanced or equally, and they're called mixed or balanced vasodilators. And we're going to talk about nitroprusside and ACE inhibitors. So in talking generally about vasodilator drugs, there are some principles that we need to follow with any vasodilator drugs. So our goal is to relieve hypertension, which is an increase in blood pressure. Increase in blood pressure for a long time can cause things like retinal detachment, bleeding in the eye, and also stroke. Although stroke is not very common, strokes are not common in small animals. But that's what we don't want to go on for too long. So initially, we're going to cause hypotension, right? We're increasing our straw size, if you will, making more room in our blood vessels. So when we have low blood pressure, the signs of that are, and I included this picture of this redneck house alarm to help remind you what it is, and it's fainting. The fancy $10 word for fainting that we're going to use is syncope, syncope. So syncope is the main clinical sign that we'll be looking for and that we can tell our clients to look for. So, and it usually happens as the animal tries to get up, they kind of fall back down. So, because the blood pressure is not rising enough to compensate for going from being horizontal to vertical. Now, that happens at first, and if it's really low, it's going to lead to the heart rate. The sympathetic nervous system is going to be activated, and it's going to stop the inhibition that normally occurs in blood pressure regulation, and then make the heart rate increase and the heart beat more forcefully to try to compensate and get the blood pressure back up. So we need to be careful, though. We do tend to administer these sometimes with other drugs, and especially with beta blockers, we need to be careful with vasodilators. So beta blockers, if you remember, they're going to block that beta 1, the beta 1s. Hopefully we're using a selective beta blocker. They're only going to block the beta 1, which regulates heartbeat and force of contraction. And I just said that the body will respond to stimulation of those beta 1 receptors by the sympathetic nervous system and increase the heart rate and force of contraction. But if we have beta blockers, that is not going to happen. So that blood pressure is going to stay low. So we want to be careful if we are administering a vasodilator with a beta blocker. They both cause low blood pressure potential, or at least the beta blocker is going to block the response to the low blood pressure caused by the vasodilator. We get some of the same effect using a diuretic. We haven't talked about these yet. I'm going to talk about them at the end of this chapter, but they basically help the body to eliminate the extra fluid that accumulates with congestive heart failure. So that is also going to be, when we have fluid retained, that's going to help increase our blood pressure, but this is going to cause it to not be as increased. So we need to be careful administering with either beta blockers or diuretics, more caution with the beta blockers. So what we do when we administer these drugs is we start off with small initial doses, so we're on the low end of the range, and then we look for these signs. So the sign is, remember, syncope, it's fainting. If the owner notices this, we want them to contact us. We're going to stop the drug for about 12 hours. We're going to lower the dose, and we're going to try to start it back up again. And it's really important to note that we sometimes switch vasodilators, and we do that because animals sometimes will adapt within weeks to months of these different vasodilators. The body says, you know what, I was trying to do something for a purpose here, and so I'm going to continue to do it however I need to do it. So depending on the mechanism, we can switch to a different type of vasodilator um, to compensate for the fact that the body may not be responding to a particular vasodilator.